Okay. So, good morning, Miss Smith. My name is Kenzie. I'm going to be your student nurse today. Congrats on your baby girl. This morning, I'm just going to start with an assessment just to see how you're doing since delivery. I'm just going to assess like your breast, your uterus, and all the things like that. And I'm here to answer any questions if you have any. Are we good to get started?
Yep.
Yeah. Okay, no problem. So, provide privacy. There. Okay, and did you have any questions before we begin?
No, I don't think so.
Okay, perfect. So I'm going to start with your vital signs. So I'm going to go ahead and get your blood pressure, okay?
Mm-hmm.
Do you mind if I just raise your bed up?
Sure.
Okay, perfect. Your blood pressure is 124/78. I'll get that off of you. Alright. And now if you don't mind, I'm just going to put this guy on your finger for your arm. I'll put your temperature as well. Okay, if you want to open your mouth and look at your tongue. Okay, perfect. 36.4. That's great. There, oxygen's 98, pulse is 74, and of course, count her respirations and not let her know. Okay. So, are you in any pain this morning?
Yeah, I'm feeling some pain where my tear was repaired, and for some reason, every time I feed, I get cramps in my stomach.
Okay, in your stomach. So, how long has apparently in pain been going on for?
It's been bothering me all night.
All night, okay. So I'm gonna bring you a cooling pad once we're all done your assessment. That should relieve some of the pain, and we'll stay on top of your medications today. And I'll just take a look around the area and make sure everything looks as it should once we get there. And is it any soreness? Like, could you describe the type of pain?
It just feels really sore.
Okay, and if you could rate it on a scale from 1 to 10, 10 would be like the worst pain you've ever had. What would that be?
Probably a 4.
4. Okay, and so like for your abdominal pain, you said it was only when feeding?
It seems that's what starts it.
Okay. And what kind of pain is that? Is it like a cramping?
Yeah, like a cramping.
Like a cramping, okay. So that sounds like what's called after pains. Have you heard of this?
No. What is it?
No? Okay. Well, it's usually just a cramping pain you feel in your uterus after delivery, hence the name after pains. It's worse with breastfeeding because our bodies release like the hormones to contract your uterus to bring it back down to its normal size before your delivery. Does that make sense?
Yeah. Is there anything that helps it?
Yeah, so I could suggest you empty your bladder maybe before each feed if you can. And I can also bring a warm compress if you like, if that's something that would make it feel better.
Yeah, if you wouldn't mind.
Okay, so now I'm just gonna grab some gloves and get started on your assessment. Okay, so our bed is already up at the perfect height. We're gonna start with your breast. So I see you've chose breastfeeding. How's that been going?
Good. Baby seems to be latching really well.
Okay, yeah, that is good. So have you noticed any like engorgement or feelings like fullness or tenderness?
No, it's a little tender, but I feel like that's normal.
Yeah, a little soreness is okay due to all the hormonal changes, but as long as it's not like anything constant, or coming with any other issues like a reddened area, or any other concerns, like, and as long as the baby's latching well, and there's no pain during the feed,
Yeah, no, it's good.
Okay. Okay, perfect. So no concern within the hoops either, like cracks, dryness?
Nope, they look and feel fine.
Okay, wonderful. Okay, that's great. So now I'm gonna listen to your lungs. If you're able to sit up, and untie the back of your gown, I can give you a hand.
Yep,
We'll
no
just put
problem.
baby over in her. Okay, baby's going with dad.
Thanks, honey.
Okay, here, we'll just untie the gown. Perfect. Now each place I put the stethoscope, I'm just gonna get you to take a nice deep breath in, okay?
Mm-hmm.
Let me know if you need any breaks.
Should be able to do that without having to turn my head or losing attention. Next thing that I'm gonna do is help the lacrimal gland here and make sure that nothing comes out when I do that. Nose, I'm looking to make sure that it's symmetrical. I'm looking to see nasal patent. So look at just to put a finger over one nostril and inhale. Finger over the other nostril and inhale. Make sure it's long and good there.
Okay, everything sounds good. I'm gonna go ahead and lay the head of your bed down flat, so we can assess your abdomen and your bowels, okay?
Okay.
And if you had a bowel movement since delivery,
No, but they told me it would be a few days.
yeah, it can take up to 2 to 3 days-ish, so that should be okay as long as there's no other pain or discomfort. Haven't been feeling any? No? Okay, perfect. So I'm gonna go ahead and listen to your bowel sounds.
Chest, we are looking for symmetry. I'm looking to see if they have any increased work of breathing. Want to see if they have symmetrical chest expansion, which I'm going to check in just a moment. I want to make sure that they don't have any accessory muscle use. So let's expose the chest a little bit at this point, but not have them fully take off their shirt or anything like that. If I'm
Okay,
testing
that's
for
perfect. So they're good. And is there any area that's hurting or sore?
No.
No. Okay, so now we're gonna go ahead and palpate your uterus. So you're gonna feel me massage. I'm just making sure that it's in the right spot where it's supposed to be. Okay. So of course I would press hard. So I'm just feeling. It feels midline. It's just below your belly button where it should be. And it's nice and firm, so that's good. There, do you have any questions so far?
No.
Okay, perfect. And so I know you haven't had a bowel movement, but have you been up to pee often?
Yeah, I peed a couple times in the night.
Okay, and have they measured that at all?
Yes, the night shift nurses did.
Wonderful. Okay, that's great. So no issues there?
No.
Okay. So, and how's the bleeding been? Have we been keeping an eye on the pads?
It's just been a bright red color. I just change my pad when I get up to pee.
Okay, so that sounds good. No large clots passed or anything?
Not yet.
Okay, here, we'll go ahead of your bed back up. Okay. Okay, and do you mind if I just take a look down in your pad and like at your tear to see how those things are looking?
Sure.
Okay, so here we'll just I'll just undo the pad. I would take a look. Okay, so there's everything looks to be going well. There's a little swelling where they stitched you up, but nothing concerning. The cool pad should help with that swelling as well.
Mm-hmm.
And I see a small bright red amount of blood, which is normal for the first few days. So everything looks good there.
Okay.
And if you flex your toes towards your nose, is there any sharp pain in your calves?
No.
Not on either side?
No.
No? I know it sounds silly, but we just do that to assess for any blood, like clots in your legs. That's something that can happen.
Okay.
Yeah. Okay, and so Jill seems bright in effect. She seems to be bonding well with baby. Her husband is present as her support person. No concerns there. So that's really it. Do you have any questions for me?
Not really a question, but I've never had stitches or anything before, so I'm just not really sure how to care for it properly.
Okay, so that's a great question. First, you're gonna want to keep the area like really clean and dry. And of course wiping front to back as per usual. And just make sure you're using like an unscented like mild soap to cleanse with.
Okay.
And I can also provide you something called like a peri bottle that can help with cleaning the area. You just add some water in there and you can aim it and spray gently and it'll help clean the area. And there's also a sitz bath available. You just put some warm water in and sit for a few minutes and let the area soak, which can soothe and cleanse. And yeah, and again, the cooling pads.
Okay.
So that's stuff we can provide you with before you go home and teach you how to use over the next little bit.
Okay.
And there's just a couple things to be mindful of, or when you should call a doctor to come back in if you're ready to go over those.
Sure.
Yeah. Okay, so we have, if you have any signs of like excessive bleeding, so if you soak like more than 2 pads in 2 hours is usually our general rule. And any signs of infection, so like that would be a fever greater than 38, a foul odor in the lochia, so your blood and you're bleeding over the next few days or weeks. Any drainage at the tear, so any like pus or foul smelling or looking discharge in the area. And then just feelings of like malaise is what we call it, just general like feeling unwell.
Okay.
Yeah, and that could indicate an infection or something going on. And if you're having any troubles with feeding, if baby's not latching properly, if there's any pain, you can always come back in, or your doctor can refer you to a lactation consultant and they can give you some help with that. And any signs of postpartum depression, so we will provide you with some resources for the difference between regular baby blues and some postpartum depression, so you can be aware of, and you and your partner can look out for signs of that. And if you have any chest pain or shortness of breath, it's important to seek help because that could indicate something going on as well. And again, the chest pain or the calf pain, or the redness in the area down there.
Okay.
And any headaches or vision changes, so like a problem there. And again, the blood clot, so any blood clot larger than a toonie should be broken open. And if it can't be broken open, that could indicate a piece of like retained placenta in your uterus, which could lead to an infection if we don't treat that.
Okay.
But yeah, that's pretty much it. We'll send you home with all that information, and I know it's a lot right now. But that's it, really. Do you have any other questions?
No.
No? Okay, I hope you have a great rest of your day.
You too.
We'll